Clinical reasoning is a backbone to the curriculum here in the physical therapy department at Mercer University. And I would define clinical reasoning as an ongoing process that occurs between a patient and a healthcare provider, such as a physical therapist, in which the two are exchanging information. So you're collecting information, you're giving meaning and value to that information to ultimately be able to respond in the best way possible. So students at Mercer University in the physical therapy department learn clinical reasoning from day one of the very first semester. And we do this so that the students have a framework to work from as they learn different skills or components of physical therapy throughout their entire curriculum. So, they don't just learn a skill, they really learn how to give meaning to that skill and how to really think about that skill. And learn how to develop it over time. Some of the ways that we encourage students to develop clinical reasoning skills include self-awareness as well as reflective practice. So part of self-awareness is just knowing who you are as a person and knowing your own maybe attitudes, values, beliefs, your personal biases, and kind of having an awareness or recognition of how those factors about yourself may be influencing your interactions with patients. The other part that is reflective practice really teaches you how to look back on interactions you've had with the patients or different skills or things that you've done and really measure them to say, did I do what I think I was doing, or could I have done that better, or was there a better choice that I maybe should have made, or something that I didn't do that I should have done. So all of those things feed into making you ultimately a better clinician down the road, because you kind of learn those lessons from your reflection on what you've already done. And it's a lifelong skill. It's something that clinicians should continue to do when they're practicing with patients as a licensed healthcare provider. And so we're really teaching you a life skill, and so that you can continue to kind of achieve that excellence over a lifetime of clinical practice.